In response to the Omicron variant's discovery in South Africa, President Joe Biden wrote this tweet saying, "Until we have more information, I am ordering air travel restrictions from South Africa and 7 other countries." So we set out to verify, do travel bans stop the spread of COVID-19? Our sources for today's Verify are medical expert Dr. Payal Kohli and Dr. Brad Pollack, Associate Dean for Public Health Sciences at UC Davis. Dr. Pollack says travel bans have been used since the beginning of the pandemic, especially over in Europe, and there is some evidence that the ban slowed down the spread.
Really, I think the main reason for having the travel bans is just to slow things down a little bit to allow us to prepare. I know that was the thought, is to have both the hospital capacity ramped up, maybe even testing capacity.
With cases of the Omicron variant now popping up in the U.S., the effectiveness of the bans are not the same as once before.
They're probably slowing it down by a couple days or maybe a week or two, so it's not months for sure.
There are also flaws in the president's travel ban that make it ineffective, says Dr. Kohli. She referenced that U.S. citizens can still travel into the country.
There is no science that says that U.S. citizens versus foreign citizens spread the virus differently. So it really doesn't make any sense from a scientific perspective.
Dr. Kohli says travel bans work best when put in place early, but at this point, Kohli believes testing and isolation may be the best way to stop the spread.
Is really to try to implement quarantining policies and testing policies in place to try to make it really equitable. If we are going to institute travel bans, it should be for everybody.
So we can verify that no, travel bans do not stop the spread of COVID-19, but when implemented at the right time and in the right way, they can slow the spread of the infection.